Hi, I'm Dr. Jonathan Aviv. I'm an ear, nose, and throat doctor practicing at the Madison Avenue location of ENT and Allergy Associates. I'm part of the Voice and Swallowing Center. I'm here to talk to you about how we treat COVID long, especially the respiratory side effects or respiratory complications of COVID long. This is a special type of issue. These are people who feel short of breath or are coughing 3 months or more after they had COVID and seemingly recovered, but are still having persistent symptoms. The other particular aspect of this type of COVID long is that the chest x-ray or CAT scan of the chest, or as we say, chest imaging, is all normal. So short of breath, you can't feel like you can walk even a block without feeling tightness or your throat closing. This is the type of COVID long respiratory problems that we're going to be addressing. What we see on the patient complaint is, doctor, I'm feeling shortness of breath. Sometimes they say, I've been coughing, and they give a distant history of having COVID long, whether they were vaccinated or not. Typically, we've seen these people beginning in the summer of 2020. It has continued since then and probably now amounts to close to 30 million people in the United States, about 80 million people worldwide. So it's a big problem. In addition to the complaint of shortness of breath with normal chest imaging, the patients say that they feel air hunger all the time. So they're hungry for air. So what do we see in the office? When we take an exam and we put a tiny little camera in the nose, put it on a video so we can review it with the patient, we see that the vocal cords, instead of closing and opening normally, they start to close and stay closed. Usually it's triggered by talking, shouting, yelling, screaming, singing, sometimes changes in temperature, going from hot to cold or cold to hot, bring it on. Other times, perfumes, odors, smells bring it on. So a series of different things bring it on. But one interesting characteristic, it will never wake the patient up in the middle of the night. So they can sleep through the night without a problem. When they're awake, that's when they start to feel symptoms. So again, what do we see? We see the vocal cords closing instead of opening. Now, if you're looking at me, I'm looking at you. We're not talking, we should be breathing, the vocal cords are open. When we talk or phonate, the vocal cords close. In between closing and opening during breathing, we should be opening these patients shut, and they stay shut sometimes for up to 10 seconds or more. So you can imagine over a 1 minute time period, your vocal cords are shut 70% of the time, you're going to feel shortness of breath. So how do we treat it? There are two main avenues of treatment, a physical therapy side and a food-based or diet-based side. The physical therapy side is called respiratory retraining, which is increased resistance breathing exercises that a speech therapist gives to the patient. It seems crazy that a speech therapy technique can actually treat a vocal cord dysfunction. As it turns out, we've been studying this for years before COVID ever approached us, and other types of viruses cause the same type of vocal cord closure. So we know that physical therapy of this nature can help. The other thing that we're doing is we're having the patients avoid very acidic foods. As it turns out, very acidic foods, that is defined as foods less than pH 4, cause irritation of the tissues innervated by the vagus nerve. So it's a two-pronged approach, the physical therapy approach and the avoiding the handful of foods that are very acidic. So what are these foods? I call them the dirty half dozen. There are 6 foods less than pH 4, 2 unhealthy, 4 healthy. The unhealthies are any flavored beverage in a can, bottle, or box, the classics, Coke, Diet Coke, Snapple, and what I call the new classics, flavored sparkling waters like LaCroix, Spindrift, Bay, Bubbly, Bang, it goes on and on. All the sports drinks, the Gatorade, the Powerade, the C4 Celsius, you have to be careful with those. The 4 healthies, citrus, tomato sauce, not tomato, vinegar, and wine. In fact, wine is the only alcohol less than pH 4. So avoid the dirty half dozen, get the respiratory retraining, and hopefully we can help you with your COVID long breathing problem.